Hello and welcome again to nutrimd. Our topic for today, constipation, can be a common challenge for some children and a growing concern for mothers. Frequency, color of stools, and in some cases, even painful bowel movement for the little ones at home. What is normal and when is it time to call your doctor? Our guest for today's episode is a pediatrician and also a mother to a young child, Dr. Angielyn Ogbac. Dr. Ogbac, welcome to NutriMD. It is a pleasure to have you with us today. Doctor, in your practice, to what extent is constipation one of the most common tolerance problems among children?
Among the infants that I see, constipation could be a common concern, especially to moms and dads. Although sometimes they come in, but they're not really constipated. The rule of thumb is for as long as they pass out soft stools easily, then they're not considered constipated.
What can you tell us about frequency? What is normal?
Normal bowel movement per day will differ according to age. Say, for example, a newborn baby initially will pass out stools about 1 to 2 times a day. But as the week closes, then the bowel frequency will increase to about 5 to 10 times a day. Actually, bowel movement after every feeding is normal for babies for as long as the stools are soft and pasty and not watery. Bowel movement changes every day, every week, and every month as it passes by. Say, for example, few days upon birth, the baby will pass out meconium, which is actually blackish green stools that are sticky. And then within the first week, their stools will change in color to about yellow or yellow-brown. Breastfed babies actually will have more yellow, more seedy stools that are pasty and runny compared to children who are formula-fed.
For first-time moms, I guess, what is the common trigger of concern relating to stool?
As we start to wean our children and give them solid feeding, then their stools may vary in color from brown, tan, yellow, or green, depending on what we feed them. This will be caused by the food additives that are in the food or whatever, let's say, vegetables you feed them.
When does the color start to be a concern, and when does she call a doctor?
There are stool colors that may cause some worry. Say, for example, a red or a blackish stool may indicate blood in the stools or maybe bleeding in the intestine. But of course, if you look back and if you look at what you feed them, if you give them beetroot or red gelatin or tomato, it may also cause red stools. If the stools turn to be white or very light yellow, then you may worry about a liver problem or a gallbladder problem, but this is not very common.
What are the signs that a baby might be constipated?
Hard stools that are difficult to pass will be considered constipation. You will notice that your baby will be straining a lot when they try to pass out stools. Their bellies will be bloated with gas. They will be crying and irritable most of the time because they're probably having some form of abdominal pain. The consistency and form of the stools will be hard, small caliber stools, or they may either be large diameter ones. Sometimes they will also have stools that are watery, but it's not as much as the watery stools of diarrhea. Sometimes, because of the very large caliber stools, it can cause a tear in the anus of the baby. And so you will see droplets of blood.
Are there foods that can help prevent constipation to maintain a healthy bowel movement?
Breast milk will always be the gold standard. It offers a unique combination of prebiotics and probiotics. Probiotics are actually the good bacteria that helps our digestive tract, while the prebiotics are the food for the good bacteria. Together, this combination supports a very healthy digestive tract. This is for better nutrient absorption and better digestion, preventing colic, constipation, and recurrent diarrhea. For the older ones, like the 3 years old and above, of course, Filipinos, we still advocate us to give your children milk. Okay, so it would be best to give your children supplemental milk that has natural sugar, which is in particular lactose. Excessive additive sugar can also contribute to constipation.
Is there a particular type of probiotic that you would recommend or suggest to mothers to look for when they buy probiotics?
Lactobacillus fermentum. This is the most abundant lactobacilli with highest survival and retention rate. For the prebiotics or the food for the bacteria, then we recommend galacto-oligosaccharides. They are tested to be safe and well tolerated by infants based on clinical studies. Together, the pre and probio, lactobacillus and galacto-oligosaccharides, helps in our digestive tract and significantly reduces gastrointestinal infections.
Colic is another concern for moms. What can you advise moms on colic, how to manage colic or how to avoid colic?
Infantile colic is related to the production of excessive intestinal gas. More commonly, this is caused by a disease-causing bacteria called Clostridium. So, in your choice of probiotics and prebiotics, galacto-oligosaccharides, like I said, have been shown to promote growth and of the good bacteria Lactobacillus fermentum. It also lowers the load of Clostridium in our gut. So, the lower the Clostridium, the lesser the chance of infantile colic.
In closing, do you have final messages or tips to our mothers about constipation?
Apart from the right nutrition, of course, we should always make sure that our children are taking in adequate amount of water. We provide them food that's high in fiber, say like fruits and vegetables and oatmeal. Avoid excessive additive sugars. It really adds to constipation. And then nutritional supplementation, as I said, with the right probiotic and prebiotic, which is Lactobacillus fermentum in particular, will help the digestive tract and prevent constipation. Now, for older children, it would be best to increase their physical activity because increasing their physical activity will also increase their gut motility and prevent constipation. Train them to go to the bathroom, have them sit in the toilet for even just 5 minutes, relax, see if eventually they get trained and they pass out stools.
Thank you so much, Dr. Ogbac. That was really very, very useful and practical advice for a lot of our mothers. Thank you for joining us today, and see you in the next episode. If you want us to cover any topic on nutrition for your children, contact us